Okay, this is Gelila International Seminary for the course Psychotherapy for Psychological Disorder in part 3, in chapter 3, basically more focusing on treating psychological disorder. Psychological disorder, as we discussed, creates intermediate effects on individual, social, and economic drain on society. Disorder make it difficult for people to engage in productive life and effective contribute to their family and to society. Disorder lead to disability and absenteeism in workplace, as well as physical problem, premature death or suicide. At societal level, the costs are staggering. Therefore, the goal of this chapter is basically to review the various techniques that are used to treat psychological disorder. Just as psychology considers the cause of disorder, in terms of biopsychosocial model of mental disorder, treating is based on psychological, treating is based on biological, treating is based on social approach. The psychological approach to reduce a disorder involves providing help to individual or family through psychological therapy known as psychotherapy. This includes the psychodynamic therapy, the humanistic therapy, the cognitive behavioral or more effective therapy. The biomedical approach reducing a disorder is based on the use of medication to treat mental disorder, as well as the employment of brain intervention technique, including electroconvulsive therapy, ECT, transcranial magnetic stimulation, TMC, and the psychosurgery. The social approach, again, reducing psychological disorder, focusing on changing the social environment in which individuals live to reduce underlying cause of disorders. This approach includes group. This approach includes the couples. This approach may include family therapy as well as community outreach program. The community outreach, for example, or the community approach is likely to be the most effective of the three approach because it focuses only on treatment, but also on prevention of disorder, according to WHO, stated on 2004. Individuals may seek therapy, which is the treatment of psychological problem, when their distress becomes severe or when they find themselves unable to function normally. Other individuals may be referred to therapy by physician, courts, or parents, or school. Couple or family group may also turn to therapy to address problem with relationship. The possible setting for this therapy include clinics, for example, hospitals, the counseling center, or private practice. The individual who attend therapy may be referred to as a client or a patient, depending on the theoretical view of the therapist and the nature of the problem. The psychological assessment is the other most important fundamental concept here. A psychologist may begin a therapy by systematically learning about the therapy needs through formal psychological assessment. Simply, psychological assessment, which is an evaluation of patient's psychological and mental health. During this assessment, the psychologist will conduct thorough interview with individual seeking help. Objective or projective test may be administered. The therapist may also get more information from family member, school, personal, medical record, and other sources that significantly helps for the therapy. In addition to psychological assessment, the patient may be seen by physician to gain information about the physical problem. After the medical and the psychological assessment are completed, the therapist may make a formal diagnosis using the detailed description of disorder provided in diagnostical manual. That's very important. And the therapist will discuss the key length how the problem may be addressed and the goal of the therapy with the clients or with the counseling. Written informed consent document will be signed, which outline financial and procedural issue of therapeutic contract. Referral to other professionals may be made if the client will need therapy in addition to or instead of the type of service the original therapist can provide. Psychotherapy, one approach of treatments is the psychotherapy, the professional treatment of psychological disorder through technique designed to encourage communication of conflicts and insights. The fundamental aspect of psychotherapy is that the patient directly confronts the disorder and works with therapists to help reduce it. Therapy includes assessing client issue and the problems, planning course of treatment, setting a goal for change, the treatment itself, and an evaluation of patient progress. The therapy is practiced by thousands of psychologists and other trained practitioners in the United States and around the world. To many people, therapy involves a patient laying on couch with a therapist sitting behind and nodding sadly as the patient speaks. However, this approach to therapy is outdated. It is estimated that there are over 400 kinds of therapy practiced by people in many fields. And most important of these are shown, for example, in Fig 11.1, you can read from your manual. The therapists who provide this treatment include psychiatrists who have a medical degree, can prescribe drug, clinical and counseling therapy, psychologists, social workers, psychiatric nurse, couple, marriage, and family therapists. That's important. Then types of therapy, especially practiced in USA. For example, the first and the most important is the psychodynamic therapy, a psychological treatment based on neo-Freudian theory in which the therapist helps the patient explore early childhood relationship and unconscious dynamics of individuals. The patient's personal concern and anxiety are discussed in this therapy. And through interpretation, the therapist tries to understand an underlying unconscious problem that are causing the symptom. The analyst may try to sum interpretation on the patient and observe how he or she responds to them. According to Schilder, for example, research conducted in 2010, the current and psychodynamic approach to treatment have 7 distinctive features. Encourage exploration, discussion of full range of patient emotion, explore resistance, or attempt to therapists to avoid distressing thought and feeling, identifying recurring theme and a pattern in therapist thoughts, feeling, self-concept, relationship, and life experience, discuss past experience, most important, especially early experience with attachment figure, focus on patient relationship and interpersonal experience, focus on therapeutic relationship including transference, explore the patient desire, fear, fantasy, dream, daydream to gain insight into how the patient views themselves and others in experience. This is most important. The patient may be asked to verbalize his or her thoughts through free association. That's the most important one, free association, in which the therapist listen while the client talk about whatever comes to his mind without any censorship or filtering. The goal of psychoanalysis, rather than psychodynamic, is to help the patient develop insights. That is, an understanding of unconscious causes of disorder. Unfortunately, the patient may show resistance, unconscious refusal to accept this new understanding, to avoid painful feeling in his or his unconsciousness. For example, the patient may forget or miss appointment or act out with hostile feeling towards the therapist. The therapist attempts to help the patient develop insight into the cause of resistance. The cessation may also lead to transference, in which, meaning that transference, the patient unconsciously redirect feeling experienced in an important personal relationship toward the therapist. For instance, the patient may transfer feeling of guilty or anger that come from the father or mother to the therapist. The psychodynamic approach to the therapy has been criticized for the several reasons, including incorporating aspects of Freudian unproven idea, being too abstract by focusing on an unconscious experience, lacking research on therapy effectiveness and utilizing long-term therapeutic model, that is not efficient in today's insurance limited world that basically criticized by others. Current psychodynamic approach frequently use shorter term focused and a goal-oriented approach. In this brief psychodynamic therapy, the therapist helps the client determine the important issue to be discussed at the beginning of treatment and usually take more active role. That is key and most important. The second, next to the psychodynamic or psychoanalysis, is the humanistic therapy. Just as psychodynamic therapy is based on the theory of Freud and the neo-Freudian, humanistic therapy is a psychological treatment based on theory of Karl Ross and other humanistic psychologists. You can see figure 1.2 in your manual. Humanistic approach in general, based on the idea that people develop psychological problems when they are burdened by limits and expectations placed on them by themselves and others. The treatment emphasizes the person's capacity for self-realization and fulfillment. Humanistic therapy attempt to promote growth and responsibility by helping clients consider their own situation and the world around them and how they can work to achieve their life goal. That is basic one. Carl Rogers developed person-centered therapy, also known as client-centered therapy, which is an approach to treatment in which the client is helped to grow and develop. The therapy involved comfortable, non-judgmental environment. Rogers argues that therapy was the most productive when the therapist creates a positive relationship with the client through therapeutic alliance. Therapeutic alliance is a relationship between client and the therapist that facilitated by several techniques. Those include genuineness, no better, free-falling thought and feeling, unconditional positive regard in which therapists value the client without any qualification, display an accepting attitude toward whatever the client feeling at the moment. The third, empathy, by actively listening to and accurately perceiving personal feelings that the client expresses. Those are the three most important issues. The third one is, next to humanistic, the behavioral therapy. The goal of some people with psychological disorder are very specific. Person with social phobia may want to be able to leave his or her house. A person with OCD may want to stop his obsession or compulsion from interfering with everyday activities. In this case, it is not necessary to revisit childhood experience or consider our capacity for self-realization. We simply want to deal with what is happening in the present, and behavioral therapy does that. Therefore, behavioral therapy is a psychological treatment that's based on the principle of learning, the most direct approach that's through operant conditioning, which uses reward or punishments. Reinforcement may be used to teach new skills to people, for instance, those with autism and schizophrenia. If the therapist becomes trouble dressing or growing, then reinforcement techniques such as providing tokens that can be exchanged for snack are used to reinforce appropriate behavior such as putting oneself clothes in morning or taking a shower at night. If the patient has trouble interacting with others, reinforcement may be used to teach the client how to more appropriately respond in public, for instance, by maintaining eye contact, smiling when appropriate, and moderating tone of voice. As the patient practices the different technique, the appropriate behavior are shaped through reinforcement to allow the client to manage more complex social situations. In some cases, observational learning may also be used. The client may be asked to observe the behavior of others who are more socially skilled to acquire appropriate behavior. People who learn to improve their interpersonal skill through skill training may be more accepted by others. And this social support may have substantial positive effect on their small emotion. When the disorder is anxiety or phobia, then the goal of the therapy is to reduce a negative affective response to fear stimulus. The other one is the exposure therapy is a behavioral therapy, one category of behavioral therapy, based on classical conditioning, principle of extinction, in which people are converted with a fear stimulus with the goal of decreasing their negative emotion response to it. Exposure treatment can be carried out in real situation or through imagination that is used to treat panic disorder, agoraphobia, social phobia, the OCD, post-traumatic stress disorder, PTSD can be. The other one, the flooding, is another technique that categorized under behavioral therapy. Is a client exposed to the source of his fear all at once. A person with agoraphobia may be taken to crowding shop, mall, or someone with extreme fear of height to the top of all the building. The assumption is that in flooding, the fear will subside as the client habituates to the situation while receiving emotional support from the therapist during a stressful experience. One most important advantage of this flooding technique is that it is quick, often effective, but disadvantage is that the patient may relapse after a short period of time. More frequently, the exposure is done more gradually. The other category is the systematic desensitization, a behavioral therapist treatment that combine imagining or experiencing the feared object or situation with relaxation exercise. The client and the therapist work together to prepare hierarchy of fear, starting with the least frightening or moving to the most frightening scenario surrounding the object. The patient then comfort his or her fear in a systematic manner, sometimes using imagination, but usually, when possible, in real-life situation. Desensitization technique use the principle of counter-conditioning, in which second incompatible response, such as relaxation, is conditioned to already conditioned response and fear response. Behavioral therapy works best when people directly experience the feared object in general. The virtual reality therapy, in another category, the therapists use computer-generated three-dimensional life-like image of feared stimulus in systematic desensitization program. A common use of helping soldiers who are experiencing post-traumatic stress disorder return to the scene of trauma and learn how to cope with the stress it evokes. Some of the advantages of virtual reality treatment approach are that it is economical. The treatment session can be held in therapist office with no loss of time and confidentiality. The other one is aversion therapy, is another behavioral therapy category, a type of behavioral therapy in which classical conditioning is used to reduce the frequency of undesirable behavior. Unpleasant stimulus is intentionally paired with harmful or social unacceptable behavior until the behavior becomes associated with unpleasant sensation and is hopefully reduced. Alcoholism is long been treated with aversion therapy. For example, in other word, aversion therapy more effective with the problem in relation to alcoholism. That's important. The other most important next to behavioral therapy is the cognitive therapy. While behavioral approach focus on the action of the patient, cognitive therapy is more focusing on psychological treatments that clients identify incorrect or distorted beliefs that are contributing to distress. This is Gelila International Seminary for the course Psychotherapy for Psychological Disorder course. Therefore, this cognitive therapy is the therapist help the client to develop new, healthier way of thinking about themselves and about the other around them. The idea of cognitive therapy is that simply changing thoughts will change emotion, and that the new emotion will then influence behavior. The goal of cognitive therapy is not necessarily to get people to think more positively, but rather to think more accurately. If the therapist can remind the client that the client has a mother or a daughter who does care, more positive feeling will likely follow. The psychiatrist Aaron Beck and the psychologist Albert Ellis together provided the basic principle of cognitive therapy. Albert Ellis, called his approach rational emotive behavioral therapy or the rational emotive therapy, and he focused on pointing out the flaw in patient thinking. You notice that people experiencing a strong negative emotion tend to personalize and overgeneralize their belief leading to an inability to see situation accurately. In rape or irrational motive behavioral therapy, the therapist's goal is to challenge this rational thought pattern, helping the patient replace the irrational thought with more rational one, leading to the development of more appropriate emotional reaction and behavior. Their cognitive therapy is based on basically his observations that people who were depressed generally had a large number of highly accessible negative thought influence their thinking. His goal was to develop short-term therapy for depression that would modify this unproductive thoughts. Therefore, cognitive behavioral therapy is one most frequently and more effective therapy since the 1980s. Therapists combine the principle of behavioral perspective with the foundation of cognitive perspective to create cognitive behavioral therapy. Hoffman, 2018, 1-8. Cognitive behavioral therapy is, CBT, simply, a structured approach to treatment that attempt to reduce psychological disorder through systematic procedure based on cognitive and behavioral principles. CBT, meaning cognitive behavioral therapy, is based on the idea that there is a link among thoughts or feeling and our behavior. Similarly, the panic disorder is a patient may misinterpret his or her feeling of anxiety as a sign of impending physical or mental catastrophe, such as heart attack, leading to avoidance of particular place or social situation. The fact that the patient is avoiding the situation reinforces the negative thought. Again, the thought, the feeling, the behavior amplify and distort each other. Therefore, cognitive therapy is based on the idea that our thoughts and feeling, behavior reinforce each other, and that changing our thoughts or behavior can make us feel the negative thoughts are reinforced and the better. See page 24, you can see the diagram. CBT or cognitive behavioral therapy is very based approach that is used for the treatment of a variety of problems including depression, bipolar disorder, anxiety, OCD, PSD, eating substance use disorder, ADHD, and psychotic disorder. This therapy is more effective on this. CBT directly treats the inappropriate behavior or distorted cognition, does not attempt to address underlying issues that cause the problem. The goal is simply to stop negative cycle by intervening to change cognition or behavior. Within CBT, the client and his therapist work together to develop goal of the therapy, the particular way that the goal will be reached, and the timeline for the reaching them. The procedure for problem solving and action oriented, and the client is forced to take responsibility for his or her own treatment. The client assigned to task complete that will help improve the disorder and takes an active part in the therapy. The treatment usually lasts between 10 to 20 sessions. Depending on the particular disorder, for example, some CBT techniques treatment may be primarily behavioral in orientation. This treatment focuses on principle of classical, operant, and observational learning. Other treatment are more cognitive, focused on changing cognitive negative thoughts related to the disorder, but almost all CBT treatment use combination of behavior and cognitive approach. Saying so, the effectiveness of psychotherapy is most important. To determine if the therapy is helpful, psychologists use outreach research. That is, studies that assess the effectiveness of different therapies. In most cases, characteristics of clients such as gender, age, disease severity, and prior psychological histories are also called control variables. The dependent measure is an assessment of benefit received by clients. They may also guide society as they decide how to spend public money to improve their citizen equality and the like. You can read this on page 25. In every case, The scientist evaluating the therapy must keep in mind that other effects rather than the treatment itself may be important, that some treatment that seem effective may not be, and some treatment may actually be harmful. One trip to the validity of an outcome research study in natural improvement or the possibility that people may get better over time even without treatment. To demonstrate that the treatment is effective, the people who participate in it must be compared with another group of people who do not get treatment. Another possibility that therapy works, but that does not really matter which types of therapy is used. Non-specific treatment effects occur when the patient gets better over time simply by coming to therapy, even though it does not matter without actually happen at the therapy session. The idea is that therapy works in the sense that it is better than doing nothing, but that all therapists are pretty much equal in what they are able to accomplish. Finally, the placebo effect are improvements that occur due to expectation one will get better than rather than actual effect of a treatment. Some outcome study compare group that get treatment with another control one group that get no treatment. Studies that use control group that get no treatment or a group that get only placebo are informative, but they arise ethical questions. Researchers do this because when there is no control group in which to compare the improvement, they cannot state that the change are due to the treatment. That is key and most important one. Key takeaway that we have already discussed was psychotherapy, simply treatment of psychological disorder, psychodynamic therapy based on the principle of Freudian and Freudian, attempt to assist patients in developing insight into their current disorder. Humanistic, the work of Carl Rogers, basically based on the people experience psychological problem when they are burdened by limit expectation, basically based on themselves and others. Others, cognitive behavioral therapy, other types of behavioral therapy can be discussed. We have already discussed all these things, and you can read more. The other one is the biomedical therapy. In addition to psychotherapy, psychological disorder may be some causes to be treated biologically. Biomedical therapy are treatments designed to reduce psychological disorder by influencing the action of central nervous system. This therapy is primarily involve the use of medication, but also include direct method of brain intervention, including ECT, TMS, and the psychosurgery, what we have discussed. The other one is the drug therapy. Psychology understands that an appropriate balance of neurotransmitter in brain is important for mental health. Psychological disorder may result if there is a chemical imbalance. The most frequent used biological treatment provides the patient with medication that influence the production and the reuptake of neurotransmitter in the central nervous system, CNS. Unlike some medical therapies that can be treated toward specific symptom, current psychological drug therapy are not so specific. They do not change particular behavior or thought process, and they do not really solve psychological disorder. The best drug combination for individual patients is usually found through trial and error. The other one is the antidepressant medication, is basically another point that highly more focus on the issues. Drug designed to improve mood are referred to as antidepressants. The antidepressant work by influencing production and reuptake of neurotransmitter that relate to emotion, including serotonin, neurofilin, and dopamine. That more focusing on those issues. Though the side effect can cause a patient to stop taking their medication, it is important that treatment be continuous rather than intermittent. There is no cure for bipolar disorder, but drug therapy does help many people. Anti-anxiety medication, drugs that help relieve fear or anxiety called anti-anxiety medication. They work by increasing the action of neurotransmitters. Antipsychotic medication, the another one, antipsychotic is called the neuroleptics, are drugs that treat symptoms of schizophrenia and related psychotic disorders. You can see this detail on page 33. Direct brain intervention therapy, for example, the electroconvulsive therapy, ECT, is another one, a medical procedure designed to alleviate psychological disorder in which electric current are passed through the brain, deliberately triggering brief seizures. The most important, another one. The other one is the transcranial magnetic stimulation, the gentler method of brain stimulation, a medical procedure designed to reduce psychological disorder that use pulsing magnetic coil to electrically stimulate the brain. That's the techniques. Now you can see on page 32 in detail. The psychosurgery is another one. Brain surgery used to improve psychological disorder is known as the psychosurgery. Is reserved for the most severe cases. The most well-known psychosurgery was the prefrontal lobotomy. That's important. The other one is deep brain stimulation. One such development that holds promise for many neuropsychiatric disorders is deep brain stimulation, in which electrodes are inserted into specific brain area and a constant electrical pulse are delivered via a battery pack inserted under the collarbone. The goal of the pulse is to alter or change the brain circuits that causing the disorder. Deep brain stimulation has been used to treat the pancreas disease, depression, dementia, obsessive compulsive disorder, substance use, and obesity, and the like. What the effectiveness of these biomedical therapies? Overall, meta-analysis supports the effectiveness of drug therapy for psychological disorder. For instance, the use of psychostimulant to reduce symptoms of ADHD or attention deficit or hyperactivity disorder is known to be successful. And many studies that find that the positive and negative symptom of schizophrenia is substantially reduced by the use of antipsychotic medications. People who take antidepressant or anxiety medication for anxiety disorder almost always reports feeling better, although drug is less helpful for phobic disorder and obsessive compulsive disorder. One problem with drug therapy is that although they provide temporary relief, they do not treat underlying cause of disorder. Once the therapy stops taking the drug, the symptom of a return in full force. That's important. Takeaway that, or we have already discussed these issues, but the social and community therapy, another one, the next to this biomedical. Although the individual therapy that we have discussed so far in this chapter focus primarily on psychological and biological aspect of biopsychosocial model of mental disorder, the social dimension is never out of the picture. The therapy understand disorders are caused, potentially prevented in large part by the people with whom we interact. People with schizophrenia do not live in the vacuum. This is Gelila International Seminary for the course Psychotherapy for Psychological Disorder. Let's continue. This social and community therapy basically focusing on group, couple, and the family. For example, the group practitioners sometimes incorporate or include social setting in which disorder occur by conducting therapy in groups. Second, group therapy is a psychotherapy in which client or the counselee receives psychological treatment together with others. That's most important issues. Then group therapy provide a safe place where people come together to share problem or concern, to better understand their own situation and learn from and with each other. That is most important. The couple one is another sometimes group therapy conducted with the people who are in close relationship. Treatment in which two people who are cohabiting, married and dating meet with the therapist to discuss their concern and the issue about their relationship. This therapy includes, in some cases, educational, providing couple with information about what is expected in relationship. Therefore, this couple therapy most important for those people who are living together and intimate and socializing one another. The family therapy is another one. In most cases, meeting in participated particular problem with one family member, such as diagnosis of bipolar disorder and another ones. Self-help group is another. Basically, it is key. And issue relation to community and mental health service, another intervention, primary intervention, secondary intervention, and tertiary intervention is the key and the most important. The other one is factors, risk factors, more focusing for psychological disorder. Now you can read this one by yourself because already stated on your manual such way that, for example, academic difficulty, attention deficit, child abuse and neglect, developmental disorder, drug, dysfunctional family, early pregnancy can be some risk factor for psychological disorder, clearly stated. And the other one is the effectiveness of these social communities, more effective. Different scholars and different researchers can reveal that this effectiveness social community approach is more, but also some of many community-based programs designed to reduce alcohol, tobacco, drug abuse, violence, delinquency, and mental illness have been successful in this intervention. The church brought about even the best of the program are on average the modest one is the community, social community approach. Key take is most important. We have already discussed these issues. The other one is the eclectic approach to therapy and seeking treatment. The eclectic is a combination of many. Most commonly practiced approach is eclectic approach. This eclectic approach to treatment in which therapists use whichever techniques seem most useful and relevant to a given patient. That is most important. Treatment, for example, for major depressive disorder usually involve antidepressants such as community-based, CBT, cognitive behavioral therapy, to help patient deal with specific problems. Therefore, eclectic is one most important. In addition, this eclectic is more of effective when you compare with another because they can use different techniques for different problems. In summary or in general, now we are finalizing our presentation, the fact that psychological disorder can create tremendous effects on social, personal, and economic drain on society. For that case, psychology bases its treatment and prevention of disorder on biopsychosocial model. Therefore, this biopsychosocial model basically focusing biological, psychological, and social causes. And the fundamental aspect of psychotherapy is that the patient directly comfort with the disorder and work with the therapist to help reduce it. Among the psychodynamic is most effective, the cognitive behavioral therapy more frequently and more effective, other psychological and community or medical based is another approach. Thank you very much for your attention.